Hi guys, my name is Iona. Welcome back to my channel, and today we are going to be talking about FND or Functional Neurological Disorder. I have this disorder. I developed it in January of 2021, and I thought I would make this video to kind of sum up what it is and all about it. And next week I'm going to do a video about my personal FND story. So let's get started. All of my notes, I have them kind of on my lap, so if I'm looking down it's just to kind of check what I was going to say. I'm also going to link all of the websites that I read and that I learned this on. I also learned some of this from my doctors. I'm not an expert, I've just read up on it and I have the condition. So functional neurological disorder, what is it? So it is an umbrella term for conditions in which there's a problem with the functioning of the nervous system and how the brain and body send and receive the nerve signals. Generally, there isn't a structural problem, meaning that the nerves and the spinal cord and the brain are all intact, they're not physically damaged, but for some reason the signals between them are getting confused. What you'll hear a lot if you have FND or if you speak to a doctor about it is they use the computer analogy. I don't know anything about computers, so this didn't really help me, but maybe it'll help you. They say that FND is like the hardware in the computer is working fine, but the software is damaged. The causes of FND are poorly understood. We don't really know the mechanisms of why these signals start to get confused or not received right. And they say that it's a grey area between neurological and psychological medicine. And it's only recently that it has been recognised as a neurological disorder and not just a psychological one. When I say just, I don't mean that it's just psychological. I'm not trying to minimize psychological disorders. I'm just saying that this is a combination of the two. It's thought. For a long time, it was thought that FND was a diagnosis of exclusion, meaning that once you had ruled out every other neurological condition or other conditions, then you would get a diagnosis. But there are actually positive signs for FND, meaning there are specific tests that can show that it is FND. I'm going to put those up on the screen now. I'll also link down below. They are quite medical, so if you don't understand them, it's not the end of the world, but it just means that there are certain tests that can be used to diagnose FND specifically, but not all FND would present in the way that would allow those tests. So what are the symptoms? The reason why I said that FND is an umbrella term is partly because the symptoms are so varied, both from person to person, but also day to day. Your symptoms can be really bad one day and then you can have a good day. You can develop new symptoms and your symptoms can change all the time. And one thing, if you speak to someone with FND, that doesn't mean that you know everything there is about FND, because everyone's symptoms are so different. Symptoms tend to fall into three categories. There is physical, sensory, and cognitive symptoms. I'm going to give you some examples of general symptoms, but like I said, there are so many, and if you check out the websites down below, you'll be able to see more specifics. So there is muscle weakness, which is what I have, seizures or non-epileptic seizures, sight loss and double vision, speech disorders where you have slowed speech or slurred speech, bladder and bowel problems, paralysis, tremors, tics, dizziness, drop attacks, gait and balance problems, and headaches and migraines. And that's just a sample of some symptoms you can have. Like I said, it is so varied. It's a really difficult condition to deal with, so many different symptoms to manage, and I think that's part of the reason why treatments are so difficult to find, because everyone's symptoms are so different. Like I said, the symptoms can vary over time. There is a possibility of complete remission, but equally there is the possibility that you don't get better, your symptoms remain forever. You can also you can go into remission and then have a sudden reoccurrence, and symptoms tend to appear suddenly and progress rapidly. Who does it affect? So this is another difficult thing about FND. There are physical and psychological risk factors. For example, if you have had trauma in your life, if you suffer from anxiety and depression, if you have had high stress at work, those are all risk factors for developing FND. And also if you have another neurological disorder, so for example Parkinson's or a stroke, 10 to 20% of people who develop FND have another neurological disorder. So there are risk factors, but equally it can happen to anyone, it can happen at any time. They don't understand it well enough yet to be able to rule out and say for certain who would get FND. It is very random. It tends to affect people over the age of 10, and it's more common in women up until the age of 50, and then 50 and over it's more equally split between men and women. It is listed as a rare disorder, but it's actually a lot more common. They say that around a third of people visiting neurological services show functional symptoms, and the second most common reason for a neurological outpatient appointment is FND, after migraines and headaches. So it's actually a lot more common than people think. Although weirdly I find it quite hard to find people in real life who have it. One of the reasons why I wanted to make this video is because when I looked it up when I first got diagnosed, I really didn't see an awful lot of people speaking about it. There are a few people on Instagram, which is great, but YouTube doesn't really seem to have much coverage from people who actually have FND, at least not who are my age. Like I said, the cause of FND is not well known. I'm going to put up, like I said, the cause of FND is not well known. I'm going to put up FND Hope, I believe, did a survey and they asked what preempted people's development of FND, and this was the results. This is quite a small scale sample, but it's interesting to see some of the different reasons and different things that might have caused it for certain people. My next segment is for one, I've just said how common it is. Although it's listed as a rare disease, it is actually pretty common. So why haven't anybody heard about it? I know that I hadn't heard about it beforehand, and when I tell people that I have FND, a lot of people don't know what it is, even medical professionals. One reason for that is because up until very recently it was known as conversion disorder, because they think there might be a psychological link to FND. They now think that for some people there isn't, and for some people there is. It's kind of random. Just because you have FND doesn't mean that you have any kind of psychological connection to the disorder. They thought that because it is a functional disorder, so when you look at scans, often they look normal. For a long time it was seen to be a sign of stress and anxiety, and it was believed that the patient was kind of causing their own illness and sometimes even pretending, faking it. They didn't really have any treatments that weren't psychological. This change only happened in the 2000s, early 2000s, 2010s. It was actually decided and kind of discovered and discussed that this is not just a psychological disorder. For some people it's not a psychological disorder at all. There is a neurological cause here, and for a lot of people psychological treatment will not work because it's not caused by psychological disorders, that it's a very real disorder, that patients are not causing their own symptoms, and that yeah, it's real, it's not in your head. The fact that that's only recently happened is really shocking, but not surprising because research and interest into this area has really been non-existent up until maybe the past 10 years. So there's so much we don't know about this illness, and that's another reason why you haven't heard about it, because it's not getting researched and it's only very recently been believed to be real. And another reason, which I'm not going to massively go into this video, but I think I might do another video on, is because of patriarchy and the way that it affects medicine. Because FND mostly affects women. Historically, women's health is not as well funded, it's not as well researched, there's not the same interest in it. For a lot of conditions that affect women, for a long time they were put down as hysteria. So it's only recently that is starting to change. If you look at other illnesses that more commonly affect women, like endometriosis, the menopause, ME, All of these things are not well funded, they're not well understood, and a lot of the times they're not believed. So there is a history of that, and FND is no different, which is infuriating, but there you go. Last but not least, on our whistle stop tour of FND, we are going to talk about the treatments for FND. As I've said throughout this video, FND is not well understood and not well enough researched at this time, and we just don't have enough treatments for it. But the treatments that we do have are very much dependent on your symptoms. There isn't a cure at this time, and as I said, for some people interventions do not help. There is a lot of importance within FND put on understanding the condition, believing the condition, on education of patients. I'll be honest, I can't really see why when I read into it why this is so important within FND, but it's something that you'll see on websites again and again. This is a real condition, your symptoms are real, explanations of it. I think part of that is we're trying to undo some of the damage that has been done over the past however many years of FND not being considered a real disorder. But for me, I was kind of given a website with information on it and then left to my own devices and kind of told, if it doesn't get better within a few months, you can come back and see us if you want. There is still psychological interventions. As I said, historically this is the only interventions that there were, but now it's just one of the options. They tend to base it on the presentation that you have. If you have struggled with mental illness previously, or you have trauma, or this condition was brought on by a very stressful time in your life, they can do things like medication, antidepressant, anti-anxiety medication. You might get put on CBT. I know that CBT is used a lot in people who have seizures with FND, to help them try and recognize trigger points and know when it's going to come on, and think about other ways to treat their mental health that might prevent the seizures. And physically, again, that's very dependent on what your physical symptoms are, but you can have physio. If you have like movement disorders, it's important to have physio that is specific to people with FND. Normal physio, they will try and get you to improve by focusing on what you're doing and trying really hard and focusing on it. But if you have FND, that's actually not going to work. One doctor explained it to me that you are all the things that you used to do automatically, your brain has suddenly started noticing that it's doing it and it's freaking out. So for me, I basically forgot how to walk, and I found walking really difficult, and my doctor said that my brain is pretty much going, hey, wait a second, we're walking now, this is weird, I don't like the way this feels, what do I do with my feet, what do I do? And then that's why you get all kind of wobbly. So you need to have a physio that kind of distracts your brain from what you're doing so that you can relearn the patterns and start to do it automatically again. Waiting list currently for neurophysio, so maybe when I get seen eventually I'll be able to tell you a bit more about that. You also can have speech therapy if you have a speech disorder, occupational therapy if you have something that's affecting your day-to-day life. They can help kind of put things in place to make things a little bit easier. The treatments, and like I said, it's very dependent on what symptoms you have. For some people they work, for some people they don't work. It's so dependent. FND is just such a unique disorder in that it's so different for every single person. Every single person experiences it differently. And I think it's really important that we talk about it, and if you have FND, you tell people you have FND and try and open up these discussions, because the more that we can learn about it, hopefully the better the treatments are going to become, and if we can get some more funding into it. So that is FND in a nutshell. I know I went pretty fast in this video. I was trying to cover everything as quickly as I could. As I said, next week I'm going to do a video on my FND story if you'd like to know about that. I hope you enjoyed this video. Please do look at the links down below. Please do read into it. It's a condition that we do not know enough about, and the more people that educate themselves, hopefully the more progress that we can make in helping people with functional neurological disorder. If you like this video, please like and subscribe. You can follow me on Instagram at Iona is still trying, and I shall see you guys next week. Bye.